enlighten you on the nature and intricacies of specific phobias and how they affect those who suffer from them. Phobias can cause people to be dangerously afraid of many seemingly harmless things. This small, adorable dog I'm holding could cause someone to have a severe panic attack or extreme distress just by being near them. If a person did have such an adverse reaction to her presence, they most likely suffer from a specific phobia, one of quite a few that I will explain to you over the next few minutes. Alright, here you go. You go now? Phobias generally develop early on in life, between ages of 7 and 11, according to sources such as SciComm.net and ADAA.org. Causes of specific phobias vary, with the most common cause being experiencing or witnessing traumatic events. Unexpected panic attacks can also cause phobias, as the subject of the phobia could be associated with the panic attack, which could also be considered a trauma. Sometimes phobias are simply unexplained or unknown in origin even to those who suffer from them. There are 5 classifications of specific phobias. I will be introducing and explaining the 5 most common phobias and 1 phobia from each classification. The 5 types of specific phobias are animal phobias, such as fear of dogs, snakes, or spiders; natural environment phobias, such as heights, storms, or water; situational phobias, airplanes, elevators, driving, or enclosed spaces; blood injection injury phobias, fear of seeing blood, gore, or medical procedures; and simply called other phobias, such as the fear of clowns, choking in social situations, and other less traumatic experiences. According to the DSM-5, 5% of children, 16% of teens, and 3 to 5% of adults suffer from a specific phobia of some kind, and females are more likely to have phobias than males. Most, if not all people, experience some sort of anxiety or have their own fears. For it to be considered a phobia by the DSM-5, the fear must physically and or psychologically impair the individual to the point where it is disabling in their daily life. Physical symptoms of a phobia acting up are a racing heart, difficulty breathing, trembling or shaking, sweating, nausea, dry mouth, and chest pain or tightness. Emotional or psychological effects of phobias include feeling overwhelming anxiety or fear, knowing that the fear is irrational but feeling powerless to overcome it, and fear of losing control and feeling an intense need to escape. The most common phobias, according to sources such as elementsbehavioralhealth.com, are acrophobia, the fear of heights, which affects about 5% of the population, as according to SciComm.net. Arachnophobia, the fear of spiders, which affects 3.5 to 6.1% of the population, according to healthresearchfunding.org. Ophidiophobia, a fear of snakes, which nearly 1/3 of adults suffer from to some degree. Agoraphobia, a fear of having a panic attack in public, which Psychology Today claims 1.7% of adults and adolescents suffer from. And mysophobia, a fear of germs which can be easily confused with OCD and is often associated with it. While those are the most common phobias, they do not represent every classification of phobia. Arachnophobia and ophidiophobia are animal phobias, but another common one is cynophobia, the fear of dogs. Cynophobia affects 7 to 9% of the population, according to healthline.com. Sometimes cynophobia can be triggered by even the smallest and most harmless dogs, not just large and threatening ones. For example, the small dog I was holding earlier could strike intense fear into the hearts of those with cynophobia. Acrophobia, the fear of heights that I mentioned previously, is an example of a natural environment phobia. Aquaphobia, the fear of bodies of water, potentially as small as a bathtub, or as large as an ocean, is also a natural environment phobia. It is often caused by a childhood trauma, such as nearly drowning or witnessing a loved one drown. An example of a situational phobia could be claustrophobia, the fear of small or enclosed spaces. Claustrophobia generally arises from some sort of conditioning at a young age, such as excessive or abusive disciplinary actions, including locking a child in a closet or small room. When someone suffers from claustrophobia, places like elevators, trains, and planes can trigger the fear response. A common blood injection injury phobia would be hemophobia, the fear of blood. Witnessing blood in real life or even on television can trigger the fear response and usually leads to an aversion to hospitals. Hemophobia can also cause a fear of injections or needles that may draw blood, so a person may end up skipping doctor's appointments out of fear. A common, though often exaggerated example of what is simply known as other phobias is coulrophobia, the fear of clowns. Clowns tend to make people feel uncomfortable if they aren't amused by them, but many people who have a simple aversion to clowns tend to label it as a phobia. The fear of clowns is a rather historically recent development, as media has often portrayed them as disturbing, and they have been the focus of many horror movies. While phobias are debilitating, powerful, and life-consuming disorders, they can be treated and cured by those who suffer from them. It is far from an easy task, however. The first step to overcoming a phobia is recognizing it. Those who suffer from a phobia likely believe it to just be some unfortunate condition they suffer from that they must live with for the rest of their lives. Once the phobia is recognized as a disorder that can be treated, the process can begin. The most effective and likely only real method used to treat a phobia is exposure. More specifically within the realm of exposure is flooding. Flooding is the process of exposing the person suffering from the phobia to their worst fear in its worst form. This process causes desensitization if it works, and can even replace feelings of anxiety with relaxation. Once a person has overcome a phobia, or even just a general fear, it is unlikely that the phobia will resurface later in life unless a traumatic event reinforces the fear. As such, most people who overcome a phobia are free from its effects indefinitely. With this knowledge in mind, I hope that you, my audience, feel properly informed on the general nature of phobias, and that this information will be helpful if you or someone you know suffers from a phobia. While the causes of phobias are not always known, the effects are almost always powerful. I wish all of those who suffer from phobias the best of luck and encourage them to realize that their fears are disorders that can be triumphed over and treated. Knowledge is power, and information on phobias can be very helpful to those who suffer from them, as it makes the fears more logical and may grant them hope that the fear can be overcome.